Okay, here we have Braden, and he came to us about 3, 4 months ago with some degenerative arthritis in his knees. And you are Evans, it was affecting your golf game, correct?
Yeah, correct.
You couldn't really turn very well.
Couldn't get my knees through the hitting area, which
Uh-huh.
of course restricted my hip turn,
Yeah,
which was basically messing up my golf swing.
yeah. And so we decided to do some laser stem cell signaling. So here we are almost 4 months later. So how are the knees holding up like you shared before?
I think they're better, doing good. Yeah,
Okay.
yep,
Okay.
yep.
All right.
Yeah, the pain is hardly have any pain anymore. Just occasionally, maybe early in the morning or something like that. And when I say pain, it's not even pain; it's more of a little discomfort rather than
Okay.
pain. I don't have any pain really.
All
But,
right.
no, I'm totally satisfied with the progress.
All right.
On how
Could you
things are
stand
going.
up and demonstrate and back up so your back is almost to that wall? Demonstrate what you were talking about. What was like the hip, the
Okay,
rotation before?
can you see me?
Yeah, well, why don't you go and push that chair out of the way so you could stand back there? Yeah, there you go. Go ahead and step back and go ahead and demonstrate.
Okay,
Mimic what was it like before and what is it like now?
the knees were really hurt before the procedure. I'd be taking on my backswing, and then I was getting more upper body and arms. I really couldn't get my knees through because it hurt too much.
Yeah.
That just move right here, and now it's a lot better. I'm able to get my knees flowing through the ball, which I can in turn get better hip turn.
Okay.
So that's how I'm judging my progress is the golf swing.
Great.
Funny way to do it, but yeah, before the procedure, I was just more upper body. I wasn't really using my legs or hips at all. It's just I couldn't get my knees through. It's just like this. But now I'm able to start flowing through the ball better.
Yeah, you could twist on that. You could twist on the hip and knee now, right?
Yeah, yeah.
Get that uncoiling mechanism.
Yeah, exactly.
Momentum. Great.
Yep.
So how many percent better is the knee pain if you had to put a number?
The pain?
Yeah.
Actually, the pain factor is probably about 75%.
All right. What about the function?
The function? You mean my overall, how much I think I've improved?
Yeah.
Probably about 25, maybe pushing 30%.
Yeah. So you're pretty much on track. We're 3, 4 months in. You're about 30% better.
Yeah.
75%. So what we'll do is, because my estimation is get about 10% better a month.
Okay.
We're pretty much right on track. So today we'll give you a shockwave treatment to kind of shock the cells to keep working.
Sure did that, yeah.
Great. And then we'll do another follow-up in about 3 months, okay, for your 6 months follow-up, all right?
I've had 4 treatments, and we're leaving go back up to our other home up in the Portland area on this Wednesday.
So we'll do your next your follow-up virtually, and when you come back next year, we'll do a live one, okay?
Yeah, we'll be back end of October, 1st of November.
Yeah, because you're a snowbird, all right?
I can't see you right now. You got this.
Oh, okay.
Yeah.
You're doing fine, so we'll follow up in a few months, okay? Glad it's working.
Okay, Dr. Yu. By the way, I saw on your rearview mirror there.
Yeah.
What's that sticker hanging down there? Huh?
Oh yeah. That's so I can park. That's so I can park here.
Oh,
yeah,
okay.
All right, there you go.
Right. Okay, I was just checking on you.
There you go. Okay. All right. We'll see you next time, Braden. Good job.
Have a good summer.
Bye-bye.